Today, you're going to learn how to get your energy back in perimenopause. So, if you've been feeling exhausted or just like bone deep tired, and nothing that you've tried, caffeine or stimulants or anything like this, nothing seems to be boosting your energy, this video is for you. Now, over the last decade, I've worked with well over 1,000 women navigating perimenopause naturally. And I'll tell you that fatigue is the number three most commonly used diagnosis code in my practice. It's so common for women to deal with exhaustion at this time. And there are a few key reasons why that's happening. But for me, myself, there was a time, gosh, earlier in my practice when I was busy working. I love my practice. I would spend 40 plus hours, and then what I would do for charting and patient care after the hours, at least 40 hours in the clinic every week. And on top of that, I love being active. I'm part of a Brazilian Jiu-Jitsu academy. So I would go and I would practice hours and hours and hours. And I know a lot of you are like this. You have things that you really enjoy that are physically demanding. You have things that are mentally, emotionally demanding, that you're kind of like your investments in life, your labors of love. And then when you go home, you have to cook dinner and clean the house and do all of these things. And all of these demands on our energy can really add up. For me, it actually led to like a deep level of exhaustion and even almost to burnout because in the mix of all of this, my hormones did shift. So at the time I wasn't in perimenopause, now I'm just moving into that phase myself. But at the time, what really shifted was my thyroid hormone. And I tell you this to let you know that, it's so true that our hormones are a huge driver of how well our body makes and then utilizes energy. And once I actually started shifting the hormones and then the underlying cause, like where I wasn't getting enough restoration. I wasn't doing enough to replenish what my body needed to keep up with those demands. So I needed to address the hormones, yes, but then also that underlying layer. And once that happened, my energy came back. And it's not where sometimes I have these spurts and all of this. It's steady, it's stable. I can rely on my energy levels and I know how to work with them. I know what's kind of usual and baseline for me, and it's good. And that's what I want for you. That's what I'm going to share here today. So I want to start first talking about the four main things that are causing exhaustion for women in perimenopause. So you can be discerning about then what will work. I want to share the go-to remedies that I see just immediately give some relief, help support energy systems, bring back a bit of energy. And then what I use specifically as a naturopathic doctor, a doctor of Chinese medicine, a functional health expert, what kind of labs I test and what I run for women to really understand what's the driver, what's happening here. Is it hormones? Is it nutrients? What's happening? So I'll share those with you at the end and then also give you a resource at the very end that you can download that has kind of everything summarized and written down so you don't have to remember it. But to dive in, the four main things I see as drivers of exhaustion in perimenopause, the first one is inflammation. As we go through perimenopause, we become more sensitive to inflammation. And this long-term chronic wear and tear of inflammation across our lives affects the part of your cells that make energy. These are called mitochondria. Inside your cells are they're actually light sensitive, which I think is so cool. But inside the cells, this mitochondria are the little factories that produce electricity. They make energy for your body to use. And inflammation is like their kryptonite. The more inflammation, it starts to damage their ability to produce energy. Another thing that also affects mitochondria is loss of muscle. Like if we're not weightlifting consistently, as we go through our 30s, 40s, and 50s, we just naturally lose lean muscle mass. And when that happens, we just start to have less mitochondria. So the two of like the inflammation and the effect of muscle on the mitochondria is a big driver of low energy levels, especially as we get older. Naturally, also in perimenopause, we become more sensitive to stress. We become more sensitive to the wear and tear of stress. And over time, if you think of your adrenal glands, where stress hormone comes from, as like a gas tank, there's only so much fuel in the tank before we start to get to where it's like, I'm not putting enough back to afford how much I'm spending, how much energy I'm putting out. And this thing that we call adrenal reserve, this gas tank in your adrenals, is their ability to bounce back from stress. As we get older, if we're not appropriately restoring our energy, we don't have enough relaxation time to counterbalance our productivity time, then this adrenal reserve drops. And we start to see less and less and less resilience and bounce back after stress. This is a big driver of exhaustion in perimenopause. And the second little piece that kind of like hitches its wagon on this is when we have that sensitivity to stress, we have low adrenal reserve, thyroid hormone gets powerfully affected by this. Just like I told you about my story where I was going through a period of high stress, it actually really tanked my thyroid. It ended up being the thyroid that was like really needed a lot of hand holding. And specifically what happens is our ability to convert inactive thyroid hormone to the active thyroid hormone, that little piece right there is what gets broken. And the thing is, this is not something most PCPs test for. Most of the time you go to the PCP, you want your thyroid checked, but they test one thing, TSH. That's the signal from the brain to the thyroid, but it tells us nothing about the amount of hormone the thyroid itself is making. So we don't know if that thyroid conversion issue is happening. And I see it a lot for women who have normal TSH. Then we look at that T3, their free T3, and see it's on the low side. It's very suboptimal. This clues us in. Oh, we've got a little 1-2 punch between adrenals and then the thyroid happening. The fourth and final piece that drives this exhaustion and perimenopause has to do with nutrient deficiencies. They just happen. I think the statistics say 70 to 90% of women are deficient in vitamin D. 40% are frankly deficient in vitamin B12. And when they say deficient, that means like pretty severely deficient. In the functional medicine world, I like to catch these things when they're just right outside of optimal range. And so it can be years from going from suboptimal to where we're frankly deficient. So you might have been living in the zone of just like suboptimal function. Kind of like the idea if we don't have enough gas in the gas tank, the body of the car doesn't go. It's the same as if we don't have enough of our essential nutrients, the car doesn't go, the body doesn't go. We don't have the energy that we need. Replacing these nutrients, it can make a world of difference, be totally life-changing. So go-to remedies. Go-to remedies, like right off the cuff, what I usually recommend for patients is that we make sure they've got a good bioavailable B vitamin complex on board, not just B12, but the whole complex. And by bioavailable, oftentimes I'm looking at, if you look on your label at that B12, is it cyanocobalamin, where the B12 is bound to cyanide? I find these things to be less bioavailable, less active in the body. Something that's called their methylcobalamin or hydroxo or adenosylcobalamin, much more bioavailable, much more readily used by the body. So usually when I'm looking at a B complex, I'm looking for something that has these more active forms of B vitamin in it. And I also like to pair it with something called coenzyme Q10 or ubiquinol. And this is actually inside the mitochondria, one of the critical pieces that allows it to make energy effectively. So for a lot of women, we start like, okay, foundational, make sure you've got these pieces on board. And there's a multivitamin I really like that brings the two of them together in just one a day. So it's possible to really make it low pill count. Makes a world of difference bringing energy levels up. The second piece I say right away before we do any labs, let's make sure nutrition is balanced. Because if our blood sugar is all over the place, we're not going to have enough energy. So balance, what does that mean when we're talking blood sugar? I like to use the hand method. Every meal, we should have the size and thickness of our palm without the fingers, protein, a solid handful of veggies or produce, and about the size of our thumb of healthy fats. Or like, if you're going to use a whole food, like half an avocado, a small kind of tiny cupped palm of nuts or seeds, things like this. So you get into whole foods with a little bit more, but we're thinking oils, condiments. We don't need too much, but a healthy amount. That ratio of nutrients helps make sure blood sugar is stable. So we have way more carbs than that and not enough protein. Our blood sugar can be up and down, up and down. So where I get a lot of energy right after I eat, and I get super tired after lunch. This tells me blood sugar is imbalanced. Now, all of this, if we eat those pieces, a little bit of nutrients, a little bit of CoQ10, balanced blood sugar, that's when I start running lab tests. I'll tell you exactly what I like to run. Test number one, I like to look at micronutrients. So I like to look at where's ferritin, where's stored iron levels at. For some women, if bleeding is really heavy, but don't make enough iron, can lead to anemia, causes fatigue. Look at B12 and look at vitamin D. Those are the big ones I like to look at right away. Whole other host of micronutrients can also be involved in fatigue. So I'll share with you here at the end a little resource that you might find helpful to really figure out like what micronutrient deficiencies you might be dealing with. Those are the big three that I'd say I run for the majority of people. I like to look at gut health and see, are we absorbing our nutrients enough? Do we have a healthy balance of microbes in the gut so that we can actually take in our micronutrients and get rid of toxic waste so that inflammation levels are being controlled, but then also our nutrients are being absorbed and used appropriately. From there, I test stress hormone and a full thyroid hormone panel. So that'll give you a pretty decent, well-rounded view of like what's driving the exhaustion and how specifically for your body to like really rehabilitate your energy production. Can go a long way for doing all of that. Now, lastly, a resource that you might find helpful, because I find in the mainstream world, it's really hard to find good micronutrient testing. I put together a small offer at low cost that you can get a kit shipped to your house directly that tests for every essential vitamin, mineral, amino acid, and fatty acid that your body needs, as well as coenzyme Q10 and a couple of other mitochondria-specific nutrients that your body needs in order to produce energy appropriately. I'm going to put a link for this offer in the description field below. If this sounds interesting, please click on it, get access to this. The kit is shipped directly to your house. All it is a simple blood draw. And then within a week to 2 weeks, we have a listing for you of all of the micronutrients that your body needs more of or it has appropriate amount of. And I go through those line by line and tell you specifically what I'm seeing and how you could work to correct some of these nutrient deficiencies and restore your energy, restore your health long term. So if that sounds interesting, go ahead, please grab yourself one of those kits below, and I'll see you next time.